Good afternoon, colleagues in Europe. Good morning, colleagues in the US and in America. And good evening, colleagues in Asia. We are now more than halfway through our Study-A-Thon. A lot of work has been going on, and I'm going to give you a brief update on where we are with progress. I'm afraid this thing is not slowing down, and in fact, the opposite. It seems like many countries, including the country I live in, are going up in the exponential curve of growth of number of cases affected by coronavirus. This is what we saw in my presentation this morning. There were 597,000 cases and 27,365 deaths attributable to this disease. Only 8 hours later, we can see how we've crossed the 618,000 cases and more than 28,800 deaths. So things are looking grim on that end. Which gives us very valuable context to understand the urgency of doing research, but at the same time doing good research so that we don't produce anything that is misleading, but rather the opposite, produce data and tools that are useful to our colleagues who are in frontline and to our colleagues who are planning healthcare in the best way possible in the current crisis. We have been covering these 4 streams of activity, including phenotyping, characterization, prediction, and estimation. This morning, when I was giving you my update, I told you that by the end of today, I was hoping that in phenotyping, we would have final phenotypes for all the outcomes, for all the populations we want to study, for all the cohorts that we want to include in our analysis. By today at some point. That is, of course, in the critical path to everything else, because if we don't have good cohorts and cohorts that are reliable, we cannot continue to do research in any of the other 3 areas. I also hoped that we would have finalized the protocols for the characterization studies. There are 2 studies that are being planned on characterization of COVID and flu, previous flus, seasonal flu cases and cohorts. One is focusing on the people who are hospitalized with a diagnosis of flu in the past or COVID in the current situation, and the other one is focusing on people who have the diagnosis to see how many of them then need hospitalization. The former one is progressing very nicely, and we have had very nice discussions, and I am hopeful that this one will be progressing on time to have results by the end of our Study-A-Thon. The second one is lagging a bit behind, but I'm hopeful that we will be able to implement most of the analysis before we finalize. In terms of prediction, we have had an interesting discussion again on the research questions that are being prioritized. Very interesting discussions around the use of these prediction tools and how they could be useful to inform patient management and also how to make decisions based on the predicted risks. I am hopeful that good progress is being made there, and by the end of today, we will have more to discuss. And in estimation, I was hoping that by the end of today, we would have diagnostics for our cohort and self-control case series analysis, and we would be in a position to launch the final analysis in a few data sets at least, so that we could have results tomorrow. This is how I see things 8 hours later. We are a little bit behind with the phenotypes without wanting to scare anyone. That is indeed the key milestone we need to achieve before we can move on with everything else. Most of the phenotypes that we're working on are relatively novel, including COVID, of course, but also other cohorts that we are creating, and they need a lot of work to make sure that they are reliable and solid before we start running the rest of the analysis. I am hopeful that these phenotypes will be, however, finalized and final in the coming 1 or 2 hours, and then we will be able to move on with everything else. Characterization wise, as I said, one of the protocols is very close to finalization and the other one is going behind. And as soon as the phenotypes are finalized and agreed, I am hopeful that we will be able to launch some analysis, hopefully in the coming few hours. We will start by having data on the previous flu cohort, which will be a very good benchmark. And then in the coming week or 2, we will be able to add in data from COVID cases, which unfortunately are growing very rapidly, as I mentioned. In the prediction field, I'm hopeful that, again, as soon as the final phenotypes have been agreed and finalized and the cohorts are solid and closed, we will be able to launch the first models. We will be training these models on flu cohorts, and this is where I'm hoping that our colleagues from Korea will be able to see whether the models that we will produce using flu data will be transportable to the COVID crisis, maybe with some modifications or some tweaks or not. And finally, regarding estimation, we are expecting the first results on safety of the target medicines in the coming hour or two, and I will be reviewing these diagnostics to see what is possible and what isn't possible, and then based on that, we will be launching our final analysis with the hope that we will have results from at least a few of the contributing databases sometime tomorrow and by the end of the Study-A-Thon. This is my quick update on what's been going on today. We've been very busy jumping from meeting to meeting and trying to adapt to this new world of virtual activity where I am learning a lot. Clearly, it's a very steep learning curve with a lot of inefficiencies when you're trying to communicate with many people at the same time, because actually that happens in different channels, and we are adapting to that, and I think we are making a great contribution and learning a lot as we do this. I would be happy now to take any questions if there are any questions from everyone in the call. You know that if you want to make questions, there's a kind of a question mark, and I'll be moderating this myself. So there's a question from Wojciech asking when is the official end of the Study-A-Thon, by the way. So I think we said at the beginning that this Study-A-Thon is a little bit different from others in that we are not expecting that we will have all the final results by the end of it, but rather we will have kicked off a few activities and maybe close some of them, but not finalize the activity. But still, having said that, the official end of the Study-A-Thon is tomorrow midnight time in Central European time. There's someone anonymous saying thank you for all you're doing. It's been a great pleasure working with this massive team of people, working 24/7 for 4 days. Okay, I'm going to stop the call there. We will give you an update in just below 8 hours from now, and we will go back to work and continue keeping up the activity and the good work. Thank you, everyone.